Good day and welcome to Enlightening Minds and Empowering Lives. I'm Dr. Chris Ramdani, and today we will be discussing an important topic. I'm talking about A1C and diabetes management. Diabetes affects millions of people worldwide and is one of the leading causes of heart disease, kidney disease, vision loss, and other serious health complications. Fortunately, effective management can significantly reduce these risks and improve quality of life. One of the most valuable tools available for monitoring long-term blood sugar control is the A1C test. Unlike a single glucose reading, A1C provides a broader picture of blood sugar levels over the previous 2 to 3 months. Understanding this number can help individuals and healthcare providers evaluate how well diabetes is being managed. Now, throughout this program, we will explore what A1C means, why it matters, factors that influence blood sugar, and practical lifestyle strategies that can support healthier outcomes. So let's begin our journey towards better understanding and improved health. Diabetes is a chronic metabolic condition that affects hundreds of millions of people worldwide and has become one of the most significant public health challenges of our time. It occurs when the body is unable to properly regulate blood glucose or blood sugar levels. There are two main types of diabetes. Type 1 diabetes develops when the immune system mistakenly attacks the insulin producing beta cells of the pancreas. This results in little or no insulin production. Then there is type 2 diabetes, which accounts for the vast majority of cases, develops when the body's cells become resistant to insulin or when the pancreas cannot produce enough insulin to meet the body's needs. Understanding the difference between these conditions is important because effective management depends on identifying the underlying causes. So in this presentation, we will focus primarily on type 2 diabetes and its relationship to A1C levels. A1C, also known as glycated hemoglobin or HbA1c, is one of the most important tests used in diabetes care. To understand A1C, we first need to know that glucose or sugar naturally attaches to hemoglobin, the protein that is found inside red blood cells that carries oxygen throughout the body. Since red blood cells typically live for about 120 days, the A1C test provides an average picture of blood glucose levels over the previous 2 to 3 months. Unlike a single finger stick glucose reading, which reflects blood sugar at one moment in time, A1C shows long-term glucose control. So this makes it a valuable tool for diagnosing diabetes, identifying prediabetes, and monitoring treatment effectiveness. Healthcare providers use A1C results to assess risk and guide decisions regarding diet, lifestyle changes, medications, and overall diabetes management. The A1C test is a simple blood test that measures the percentage of hemoglobin molecules in red blood cells that have glucose attached to them. Because red blood cells live for approximately 2 to 3 months, the test provides an estimate of average blood glucose level during that particular period. The test can be performed in a laboratory from a blood sample or actually can be done also in many clinics using point-of-care devices that produce results within minutes. One of the major advantages of the A1C test is that fasting is usually not required. Unlike daily blood glucose checks, which only show blood sugar levels at a particular moment, the A1C test offers a broader picture of long-term glucose control. This makes it especially useful for diagnosing diabetes, monitoring treatment effectiveness, and helping patients and also healthcare providers to make informed decisions about diabetes management. Understanding A1C ranges helps us determine whether blood glucose levels are normal, elevated, or in the diabetic range. An A1C below 5.7% is considered normal, indicating that average blood sugar levels have remained within a healthy range over the past 2 to 3 months. An A1C between 5.7 and 6.4% falls within the pre-diabetes category. This means blood sugar levels are higher than normal, and there is an increasing risk of developing type 2 diabetes in the future. An A1C of 6.5% or higher on appropriate testing is used to diagnose diabetes. For individuals already living with diabetes, healthcare providers often recommend an A1C target below 7%, although goals may vary depending upon age, health status, and individual circumstances. Knowing your A1C number is an important step towards monitoring progress and reducing the risk of long-term complications. A1C is much more than just number on a laboratory report. It is one of the most important indicators of how well diabetes is being managed over time. Research has consistently shown that higher A1C levels are associated with a greater risk of long-term complications. When blood glucose remains elevated for months or years, it can damage blood vessels and nerves throughout the body. This increases the risk of heart disease, stroke, kidney disease, vision problems, nerve damage, and poor wound healing. So by monitoring A1C regularly, healthcare providers can evaluate whether a treatment plan is working and make adjustments when necessary. For many adults with diabetes, a target of A1C below 7% is often recommended, although individual goals may vary, as I've mentioned before. Maintaining A1C within the recommended range can significantly reduce complications, improve quality of life, and support long-term health and well-being. Persistently elevated A1C levels indicate that blood glucose has remained high over an extended period, increasing the risk of serious health complications. One major concern is cardiovascular disease, including heart attacks and strokes, which are among the leading causes of illness and death in people with diabetes. High blood sugar can also damage the kidneys, a condition known as diabetic nephropathy, potentially leading to reduced kidney function or even kidney failure. Another common complication is diabetic neuropathy, where nerve damage causes symptoms such as pain, burning, tingling, or numbness, particularly in the hands and feet. The eyes are also vulnerable. Diabetic retinopathy damages the small blood vessels of the retina and may eventually lead to vision impairment or blindness if left untreated. The encouraging news is that maintaining a healthy A1C level can significantly reduce the risk of these complications and also help to preserve long-term health and the quality of life.